There is a quiet shift that happens inside the body after 60, and most people never notice it while it's happening. The same medication you may have taken safely for years, sometimes decades, can suddenly begin affecting your body very differently. Not because the medication changed, because your body did. And in some cases, that difference is not small. It can slowly increase strain on the heart, affect circulation, alter blood pressure, interfere with oxygen delivery, or change the balance between clotting and bleeding in ways that become more important with age. What makes this especially dangerous is that these changes usually do not feel dramatic in the beginning. No sudden warning, no sharp pain, no obvious signal telling you something is wrong, just small changes building quietly in the background over time. And today, we're going to talk about 5 common types of medications that researchers and physicians monitor much more carefully after the age of 60, because under certain conditions, they may increase cardiovascular risk, especially when they continue being used exactly the same way they were years earlier. But this conversation is not about fear, and it is definitely not about stopping medication on your own. This is about understanding how the body changes with age and why certain medications sometimes need to be reevaluated as those changes happen. Because once you understand the mechanisms, you stop looking at medications as simply good or bad. You start understanding context. And in medicine, context changes everything. One medication can be extremely helpful in one situation and problematic in another. One dosage can be completely appropriate at 50 and excessive at 70. And yet, many people continue taking the exact same medications at the exact same doses for years without ever having a detailed conversation about whether their current body still responds to them the same way. Not because anyone is careless, but because these changes happen gradually, quietly, almost invisibly. Now, to understand why this matters after 60, we first need to talk about what aging actually changes inside the body, because most people assume aging simply means getting older. But biologically, something much more specific is happening. The liver, which processes many medications, becomes less efficient over time. The kidneys, which filter excess substances and waste from the bloodstream, also gradually lose part of their filtering capacity. And that means medications often remain inside the body longer than they once did. So, the same dose that once passed through your system normally may now build up more slowly, creating stronger or longer-lasting effects than intended. But that is only part of the picture. Blood vessels also change with age. Arteries become less flexible. The inner lining of blood vessels becomes more sensitive to stress and inflammation. Circulation patterns shift. The cardiovascular system becomes less tolerant of sudden changes in blood pressure, fluid balance, or oxygen levels. And this is where medications begin interacting with the body differently. A medication that slightly increases blood pressure at 40 may create much more strain at 70. A medication that mildly affects circulation in younger adults may become far more significant in someone whose arteries are already less elastic. And this is why cardiovascular risk becomes such an important conversation after 60. Because heart attacks and strokes rarely happen from one single moment alone. In many cases, they develop through years of accumulated strain inside the system. And sometimes, medications unintentionally contribute to that strain without the person ever realizing it. Now, before we go further, there is one very important thing to say clearly. Nothing we discuss today means you should stop any medication on your own. That is not the goal. The goal is awareness, because awareness leads to better conversations. Better conversations lead to better monitoring, and better monitoring often prevents problems before they happen. Now let's begin with the first category of medications. This one is extremely common. Millions of adults over 60 take these medications regularly for pain, arthritis, inflammation, or back discomfort. They are called NSAIDs, or non-steroidal anti-inflammatory drugs. This includes medications like ibuprofen and naproxen, and for many people, they feel simple and harmless. You take one, the pain improves, you continue with your day. But underneath that relief, several things are happening inside the cardiovascular system. These medications work by blocking enzymes involved in inflammation. That is what reduces pain. But those same enzymes also help regulate blood vessel function and blood flow. And after 60, that balance becomes much more delicate. NSAIDs can contribute to narrowing of blood vessels, increased blood pressure, and fluid retention. At the same time, they may place additional strain on the kidneys, which are already working less efficiently with age. Now the heart has to work harder. The blood vessels become tighter. The body retains more fluid. And over time, this combination can quietly increase cardiovascular strain, especially in people with high blood pressure, diabetes, or existing heart disease. What makes this misleading is that the relief from pain feels immediate, but the cardiovascular effects build slowly. You do not feel blood pressure rising day by day. You do not feel extra strain building inside arteries in real time. But over months and years, those small effects accumulate. And this is why long-term daily use of NSAIDs after 60 often deserves careful review. Not necessarily avoidance, review. Because in some situations, they are still extremely useful. But the context matters. Now, the second category surprises many people because these medications are usually associated with stomach protection, not heart risk. These are proton pump inhibitors, often called PPIs, medications like omeprazole and esomeprazole. They are commonly prescribed for acid reflux, heartburn, or stomach irritation. And on the surface, they appear very safe. But here is what many people do not realize. Stomach acid is not just there to create discomfort. It also plays a major role in nutrient absorption, especially magnesium, calcium, and vitamin B12. And over time, long-term suppression of stomach acid may reduce the body's ability to absorb these nutrients properly. Now, why does that matter for the cardiovascular system? Because magnesium plays an important role in maintaining stable heart rhythm. Calcium affects blood vessel function and muscle contraction. Vitamin B12 is involved in nerve function and vascular health. When these systems become disrupted over time, the cardiovascular system becomes more vulnerable. And there is another layer researchers continue studying. Some evidence suggests long-term PPI use may affect endothelial function, meaning the health of the inner lining of blood vessels. And that lining is critical for circulation, vessel relaxation, and proper blood flow regulation. Again, none of this means these medications are automatically dangerous. Many people genuinely need them. The issue is duration. Because many individuals begin taking them for short-term symptoms and then continue for years without reevaluation. And after 60, that matters much more than people realize. Now the next category moves us deeper into how medications affect circulation and oxygen delivery directly. These are benzodiazepines, medications used for anxiety, sleep, or calming the nervous system. Examples include diazepam and lorazepam. These medications can absolutely help people in certain situations, but after 60, the body often becomes far more sensitive to them. They remain in the system longer. Their sedative effects become stronger. Reaction times slow more easily. Movement decreases. And this matters because circulation depends heavily on movement. When physical activity decreases consistently, blood flow becomes less efficient. The risk of clot formation increases, muscle strength declines, oxygen delivery throughout the body becomes less optimal. But another issue happens during sleep. These medications may worsen shallow breathing or sleep-related breathing problems in some individuals. And when oxygen levels repeatedly dip overnight, even mildly, the heart experiences additional stress. Now combine reduced movement, lower oxygen delivery, and an aging cardiovascular system already under strain. The result may not feel dramatic at first. It may simply feel like fatigue, slower mornings, brain fog, reduced stamina. But underneath, the cardiovascular system is working harder than it should, and over time, that matters. Now let's move to something many people never even think about as cardiovascular medication. Decongestants, especially medications containing pseudoephedrine. These are often taken during colds, allergies, or sinus congestion. And because many are available over the counter, people assume they are automatically harmless. But their mechanism directly affects blood vessels. Decongestants work by constricting blood vessels to reduce swelling in the nasal passages. The problem is that this constriction does not stay limited to the nose. It affects blood vessels throughout the body, including the cardiovascular system. Blood pressure rises. Heart rate may increase. The heart works harder to move blood through narrower vessels. In younger adults, this effect is often tolerated without issue. But after 60, when arteries are already less flexible, the same effect may become far more significant, especially in someone who already has hypertension or cardiovascular disease. And this is where medication combinations become extremely important, because many people are not taking only one medication. They may already be taking something for blood pressure, pain, sleep, or circulation. Then a cold medication gets added temporarily. Individually, each medication may appear manageable, but together, the strain on the system increases. And this is exactly how people become caught off guard. The final event may appear sudden, but the buildup was happening quietly for a long time. Now the fifth medication category may surprise people more than anything else. For years, it was viewed almost as a universal protective habit after a certain age: low-dose aspirin. For decades, millions of adults were advised to take baby aspirin daily to help prevent heart attacks and strokes. And in some situations, aspirin still plays a very important role, especially for people who have already experienced cardiovascular events or have very specific risk profiles. But newer research has changed how physicians think about aspirin for many adults over 60, because aspirin works by reducing clot formation. That can absolutely help prevent clots that block blood flow to the heart or brain. But clotting also serves a protective function. It helps stop bleeding when blood vessels become damaged. And after 60, blood vessels become more fragile. The digestive tract becomes more sensitive. The balance between clotting and bleeding becomes more delicate. So while aspirin may reduce clot-related events in some individuals, it may increase bleeding risk in others, especially internal bleeding in the stomach or brain. And this is where individualized medicine becomes essential, because aspirin is not simply good or bad, it is specific. The right person may benefit enormously. The wrong person may face unnecessary risk. And this is exactly why modern recommendations focus much more heavily on individual risk assessment rather than automatic daily use for everyone over a certain age. Now, if there is one major theme connecting everything we discussed today, it is this: the biggest risk often comes from continuing old routines while the body itself has quietly changed. Because after 60, your body is not simply an older version of what it once was. It processes substances differently. It responds differently to stress. It compensates differently. And small imbalances that once meant very little may now matter much more. This is why medication review becomes one of the most important parts of long-term health after 60. Not panic, not fear, review. Asking simple but powerful questions. Do I still need this medication at the same dose? Has my risk profile changed? Are there interactions I should be aware of? Are there safer alternatives now? Those questions change everything, because prevention is rarely about one dramatic intervention. Most of the time, prevention happens through small adjustments made early, and awareness is what creates those adjustments. Now another important point. Your body usually gives signals long before major events happen. Not dramatic signals, subtle ones, more fatigue than usual, lightheadedness, shortness of breath during activities that once felt easy. Changes in blood pressure, reduced stamina, poor sleep quality. These changes often seem easy to ignore, but sometimes they are early signs that the system needs reevaluation. And when those signals are combined with regular medication review, many risks can be reduced long before serious complications develop. Because ultimately, medications are tools, very important tools, but tools still need adjustment as conditions change. And after 60, the body changes more than most people realize. That is not a failure, it is biology. And understanding that biology gives you something extremely valuable, the ability to make more informed decisions moving forward. Not from fear, not from panic, but from understanding. Because the goal is not to remove everything. The goal is to make sure everything you are taking is still working in your favor today, not just years ago. And sometimes, the most important step in protecting long-term cardiovascular health is not adding another medication. It is simply taking a closer look at the ones already there.